Hi, welcome and thank you all for joining us for today's talk. This is DMAS's annual Fall Consumer Direction presentation. We held a number of these town hall sessions to make sure everyone received a chance to listen in on this presentation. This is the last DMAS held town hall for the year, so if a member, EOR, or attendant you know couldn't make any of the live events, please share this recording with them for reference. Now, for introductions. My name is Matthew. I'm the Quality Engagement Coordinator, or just a fancy way of saying that I create and present trainings, here with the Department of Medical Assistance Services, or as we call DMAS. As a reminder, as always, I will share our email at the end of this presentation for you to send any personal questions you may have regarding consumer-directed services. Okay, so we have a lot to go over in a small amount of time, so let me stop rambling and get started. Why are we here? We're here to educate and update the community, you all, on consumer direction refreshers and updates, as well as discuss EVV compliance. So again, on today's agenda, we're going to go over some refreshers, some updates, the electronic visit verification, or EVV, as well as share some resources. So, who is DMAS? The Department of Medical Assistance Services provide access to high-quality healthcare coverage and services through Virginia's Medicaid program in partnership with the Centers of Medicare and Medicaid Services, or better known as CMS. DMAS is the state Medicaid agency, and again, we provide access to high-quality healthcare, and we do this by education and quarterly trainings such as these, and by providing resources to get the help you need. Again, I will share how to access this information at the end of the presentation. What is home and community-based services? Support services that are necessary to enable an individual to remain at or return home rather than an institution. Services may include assistance with bathing, dressing, toileting, transferring, and nutritional support necessary for consumers to remain in their own homes or in the community. Individuals must be Medicaid eligible to receive a Medicaid waiver service. The local departments of social services determine Medicaid eligibility. The DMAS website offers information which may be helpful, and the website link is here below. Just to highlight some models of service delivery, they include agency directed, which is more traditional, and this is services that are provided by staff employed by a provider agency. On the other hand, consumer-directed, which is what we're going over today, includes individuals receiving services and directing their own care, as well as staff is employed by the member or the representative, and the member receives support from a service facilitation provider, and finally, this offers personal assistance services as well as respite. What is consumer direction? Consumer direction is a service delivery model that helps Medicaid members manage how they receive their services. Again, this is a presentation about consumer direction, but we want to make sure everyone knows the difference. So to dive a little bit deeper into agency versus consumer, just wanted to highlight again some information on both. So on the left-hand side, agency directed are services where an agency is responsible for providing staff to maintain records and assess the times and dates the staff will assist the member. This also consists of personal care hours, which are limited to 56 hours per week. And this is great for families that cannot use CD services because they can't find an EOR. So on the other hand, consumer-directed, which is on the right side, are services that the person and/or the EOR is responsible for hiring, training, firing, and supervising the attendant. Attendant provides support and/or specific services covered by the state and whose wages are paid by DMAS through a fiscal agent or FEA. They also receive assistance from the services facilitator, or in short, the SF. And to continue, just some quick takeaways from both. The choice of the model of care is made freely by the individual if the individual is not able to make a choice. Both personal care services may be provided in a home or community setting to enable an individual to maintain the health status and functional skills necessary to live in the community or participate in community activities. A waiver individual may receive both CD and AD personal care services if the individual meets the criteria. Hours received by the individual who is receiving both CD and AD services shall not exceed the total number of hours that would be needed if the waiver individual were receiving personal care through a single delivery model. Consumer and agency-directed services shall not be used at the same time but may be provided one after the other. Consumer direction programs. Programs that participate in the CD model of care. These are CCC Plus, or Commonwealth Coordinated Care Plus Waiver, the CL, or Community Living Waiver, the FIS, Family and Individual Support Waiver, and finally the EPSDT, which stands for the Early and Periodic Screening, Diagnosis, and Treatment. Services available through consumer direction consist of personal care, respite care, and companion care. To highlight personal care, this helps individuals with their activities of daily living. Activities of daily living, or ADLs, consist of dressing, bathing, toileting, eating, and more. Instrumental activities of daily living, or IADLs, include meal preparation, cleaning the kitchen, making and changing the bed, laundry, and more. This also provides supervision when the individual cannot be left alone, and also consists of special maintenance, which is vital signs and supervised medication administration. And moving on to respite care, which is care provided for the relief of the unpaid primary caregiver, for example, a family member. It provides the unpaid caregiver time to do things that they need to do for themselves or other members of the family. A respite attendant assists the individual at home and in the community with tasks the family or caregiver normally helps with, giving the family and caregiver the needed time away. This consists on a fiscal year basis, which is July 1st to June 30th, with a set rate of 480 hours. And finally, companion care, which is companion services, are defined as assisting adult individuals with housekeeping, shopping, and community activities. Companion care is only available to CL and FIS waiver individuals aged 18 or older, and it is not available to the Commonwealth Coordinated Care Plus or CCC Plus waiver or EPSDT benefit. Consumer direction benefits. The Medicaid individual may act as their own employer, or they can designate another person. To highlight some of these benefits, they include consideration of the individual's needs and preferences, the responsibility to recruit, hire, employ, train, and fire attendants, control of employment decisions, as well as give an increased opportunity for choice of attendant who provides the services. EOR role and eligibility. The decision to use consumer-directed services means that the individual or someone the individual chooses will be the employer of record, or EOR, of the attendants providing the supports and services instead of agency-directed care. The EOR must be at least 18 years old. A parent or other responsible party must act as the EOR if the member is under the age of 18. The EOR can only serve on behalf of one individual, except if the individuals reside at the same address. The EOR cannot be paid to direct care. They cannot be the paid attendant, and they cannot be the service facilitator, or DSF. EOR and attendant roles and responsibilities. In short, the employer of record performs the functions of the employer and can be the Medicaid member or a designated representative. The attendant or caregiver is the person who provides care to the Medicaid individual. The roles and responsibilities of the EOR include recruiting, interviewing, hiring, training, directing, and supervising all attendants, firing attendant if necessary, making schedules and tasks to be completed by each attendant, managing and evaluating the work of each attendant, keeping track of the services provided by the attendant, and establishing a system for signing and submitting work shift entries to the FEA on a timely basis. EOR key takeaways. Remember, it's important when providing care to follow the member's plan of care form. The plan identifies the individual's needs. Please discuss this with your attendant when services are being provided. I'll show you what this form looks like shortly. Please note that you are the employer, not DMAS, not the fiscal agent, or the service facilitator. It's important that you read the EOR manual to use as a guide to help you be successful in your role as an employer. As always, a link will be provided at the end of the presentation for the EOR manual. Your service facilitator, during your initial visit, should have provided you with the plan of care form. If you do not have a copy, please reach out to them for the most updated copy of that form. Attendant roles and responsibilities. Eligibility of the attendant include: they must be 18 years or older, have the skills to perform services as specified in the individual service plan, have basic math, reading and writing skills, have a valid social security number and be authorized to work in the United States, submit to a criminal history background records check through the Virginia State Police, and if the individual being served is a minor, the Virginia Department of Social Services and Child Protective Services Central Registry. They must also demonstrate the capability to perform health maintenance activities as required and that are in the service plan, or be willing to receive training in performing these activities. They must not be the individual's service facilitator or case manager or support coordinator, and they must not be the person designated as the EOR who is directing the care of the individual receiving service. Attendant key takeaways. They are the person who is hired by the EOR. Your service facilitator, during your initial visit, should have provided you with this plan of care form. If you don't have a copy, please reach out to your service facilitator for a copy of that form. It is the attendant's responsibility to clock in and clock out per shift using a mobile application or device. It's important to do this daily while working shifts for payroll purposes. The EOR approves shifts per pay period. Service facilitator and fiscal employer agent roles and responsibilities. To sum up, the service facilitator helps the Medicaid individual in hiring, training, and supervising attendants for the following benefits and programs. They include the CCC Plus, CL and FIS waiver, as well as the EPSDT. Fiscal employer agent pays the attendant and follows tax rules on behalf of the individual. The roles and responsibilities of the service facilitator include making sure the individual gets the services needed, developing the service plan with the individual and the EOR, provide the fiscal employer agent the appropriate forms to start the process of establishing the EOR, reviewing the EOR manual with the EOR, submit requests for service authorization of CD services to the appropriate service authorization contractor. They train the EOR on the required tasks of an employer, document services as required by DMAS, assist the EOR when filling out paperwork for the FEA, and conduct required routine and reassessment visits. And some takeaways are: the service facilitators link the Medicaid individual to the FEA. During the initial visit, the SF and Medicaid individual and/or the EOR has a meeting of the minds with the plan of care form. They're responsible for providing a copy of the plan of care or a link to access the resource during the initial visit. The roles and responsibilities of the FEA include management of enrollment packets, helping the EOR and attendants with the enrollment process, processing attendant employment and tax-related documents, payroll processing and issuance of paychecks to attendants every 2 weeks with the receipt of fully completed and signed shifts for DMAS approved services. They also file employer taxes on your behalf, complete of criminal background checks for each attendant. They also issue W-2s at the end of the year, and they answer questions that the EORs and attendants may have about payroll and services. FEA Key Takeaways. FEAs provide tools and resources for EORs and attendants to be able to access the individual's portfolio or the member page, which gives them access to shift summaries, access to submit shifts, onboarding documentation, and much more. A reminder, the FEA is not the employer. DMAS and FEA do not hire attendants. Again, that is the EOR's responsibility. As mentioned before, this is the plan of care form. The plan of care form is developed by the service facilitator and the Medicaid individual and/or the EOR. They meet to discuss the services needed to help provide the best care for the Medicaid individual. This is the time to establish the tasks and schedule for the Medicaid individual. The plan of care form is used to identify the amount of time the attendant is needed to assist the member with daily tasks. For example, the time and tasks identified in the plan for a Monday should reflect time worked and tasks performed by the attendant on that same day at the end of their shift. The plan of care form includes activities of daily living, or ADLs, which consists of assisting eating, grooming, turning and changing the position of the member. IADLs, on the other hand, which stands for Instrumental Activities of Daily Living, include cleaning areas used by the participants, shopping and listing supplies, as well as transporting to medical appointments. Although the attendant works for the individual should not ask the attendant to do work outside of the scope of the plan of care. The attendant's hours and schedule must match that plan of care form. The CD service facilitator will provide management training and skills development for the individual and agrees to supervise the service plan in a manner that ensures the individual's health, safety, and personal autonomy, including periodic monitoring of the provision of the services. They also ensure that services provided to the individual are authorized as well as appropriate. In addition, the CD service facilitator agrees to maintain appropriate records and to provide the individual with information necessary for the individual's continued participation in the Virginia Consumer Direction Services program. And again, a copy of the service plan should be in the member's home. It is a guide of what has been requested and approved to meet the member's needs. What is EVV? In short, Electronic Visit Verification, or EVV, is an electronic system used to comply with the state-regulated care services. EVV takeaways. EVV allows the attendant easy access to submit their shifts in real time. Now, you can even see if and when they're approved. Plus, if corrections are needed, they can be updated in the same pay period. EVV also allows the EOR to review and approve shifts daily, weekly, or at the end of the pay cycle. This flexibility ensures you are paid timely. To avoid a delay in pay, use EVV. EVV. Who does what? The attendant is responsible for clocking in and out in real time each shift by either the EVV mobile app or IVR phone system. This ensures timely pay and shift accuracy. The employer of record is responsible for making sure the attendant uses the EVV mobile app or IVR phone system to start and end their shift. They also approve the shifts for the attendant. And to note, EORs, please make sure you are approving and submitting actual shifts worked per pay period. The 6 requirements for compliance. The 6 requirements are the type of services delivered, individual receiving the service, date of the service, location of the service, individual providing the service, and time that the service begins and ends. It is required to put the type of service you performed, where you performed them at, who received the services, clocking in and out time, your name, and the tasks you perform during each shift. So to compare, EVV, which is compliant, versus the web portal, which is not compliant. The electronic visit verification, or EVV, reduces billing errors and improves payment accuracy, which introduces program integrity. It also promotes quality outcomes for the individuals, which is quality care, and promotes oversight of the services provided, which complies with the federal and state requirements. On the other hand, the web portal is not EVV compliant. The web portal is, on the other hand, available for live-ins who can be exempt from EVV, but the mobile app is encouraged. Again, this is not intended for use by the attendants who are required to use the EVV method. EVV versus web portal takeaways. The web portal is available for live-ins, but we encourage you to use EVV or the interactive voice response system to submit shifts and the EORs to manage and correct those shifts. The web portal is a last resort. The web portal can also be used for EORs to manage, approve, and accept those shifts. EVV is used to manage time, increase payment accuracy, which will reduce billing errors, all while promoting quality of care and member safety. Continued noncompliance or submitting shifts through a non-EVV method could result in the member being disenrolled from consumer direction. DMAS and the MCOs are closely monitoring EVV compliance and will be making outreach to EORs to ensure state compliance. Sick leave. The 2021 General Assembly passed a bill requiring employers of home health workers to provide paid sick leave benefits to essential employees who work an average of 20 hours per week or 90 hours per month. Sick leave qualifications. Who qualifies? CD attendants who work an average of 20 hours per work week or at least 90 hours per month. How do they earn it? Qualified consumer-directed care attendants will earn 1 hour of sick leave per every 30 hours worked. When can it be used? Sick time is available to use on the first day of the second month after the qualifying quarter. For example, if an attendant qualifies in quarter 2, October through December, the attendant can use earned sick time beginning February 1st. Sick leave will be applied automatically for eligible attendants. No additional steps are necessary for qualified attendants to earn sick leave. Sick leave questions? Questions may be directed to the following fiscal employer agents: Consumer Direct Care Network, or CDCN, and the managed care organizations for CDCN include Centera and Aetna. Public Partnerships LLC, or PPL. The managed care organizations for PPL include Aetna, United, as well as Anthem. The Employer of Record Manual includes information on the sick leave policy. As stated before, I will provide a link for that manual at the end of this presentation. You may also submit questions to DMAS at cdattendantinfo@dmas.virginia.gov. And moving into the consumer-directed services updates, first we have legally responsible individuals, or LRIs. A legally responsible individual is the spouse of a Medicaid member or parent, step-parent, legal guardian of a Medicaid member under 18 years old. Today we are going to stick to talking about consumer-directed LRIs. If you have any questions regarding waivers, please see your support coordinator. All services rendered by a paid LRI must be within the scope of the personal assistance service and are limited to support with ADLs. IADLs and general supervision are not considered extraordinary care. A registered nurse must delegate skilled tasks in accordance with the Virginia Administrative Code. LRI takeaways. LRIs may work up to 40 hours per week for each child. Instrumental activities of daily living, general supervision, and respite hours are not permitted when there is a paid LRI. Please note, there are no program requirement changes for parents who are the aide or attendant for members who are over the age of 18. Next update we have is the 16-hour workday limit. The state did enforce the 16-hour limit per day on providing active care, which started on September 1st, 2024. This is a regulatory requirement for health and safety concerns. The reason for these concerns is that there are examples of people working excessive hours, 23 hours per day, and we've seen these 2 to 3 days in a row. 16-hour takeaways. The contractor's FEA shall create an edit to limit all attendants to working 16 hours per day. A day is defined as 24 hours from 12 a.m. to 11:59 p.m. The contractor's FEA shall have an edit in place to ensure the 16-hour limit includes any time submitted in a 24-hour period for all services. The contractor's FEA shall ensure that the 16-hour edit applies to all attendants regardless of live-in status. The contractor's FEA shall ensure attendants who work for multiple consumers do not exceed 16 hours in a day. This is 16 hours while the attendant is awake and alert. The state will not pay attendants while they sleep. Our next update is documenting tasks worked during the shift. Starting January 1st, 2025, attendants will be required to document what services were performed while caring for the member. Documented task takeaways. The contractor's FEA shall incorporate into its EVV system and web portal a method for attendants to document tasks or activities completed during each shift. The system shall include a list of tasks in accordance with the attached provider aid record, the DMAS 90. Tasks performed during work hours include ADL and IADLs. We encourage that tasks are documented in real time. All services reimbursed by Medicaid must have documentation. Attendants will be required to enter tasks at the end or during each shift. DMAS was reviewed by CMS in 2019, and they did find that DMAS was not compliant with this requirement. Tasks performed are as follows: complete and partial bath, dress and undressing, assisting with toileting, transferring, personal grooming, assisting with eating and feeding, ambulation, turning and changing position, vital signs, assisting with self-administration of medication, bowel and bladder, wound care, range of motion, supervision, preparing breakfast, lunch and dinner, cleaning the kitchen, including washing dishes, making and changing the bed linen, cleaning areas used by the individual, listing supplies as well as shopping, doing the individual's laundry, taking them to medical appointments, work, school, and social, as well as others described. Again, you must document tasks in real time. This provides current information of the member to ensure that that plan of care form is still up to date and valid. Tasks that are performed and documented must be consistent with those in that plan of care form. And for our last update, we have the 30-day shift submittal. Starting January 1st, 2025, attendants will have 30 days to submit their shift with the approved shift submittal method. This includes EVV app and the IVR phone system. 30-day shift submittal takeaways. The contractor's FEA shall create an edit to limit all attendants to submitting time within 30 calendar days of the date of service. The contractor's FEA shall develop a process to review all shifts older than 30 calendar days from the date of service if one of the following exceptions apply. Number 1, background check delay. Attendants can work temporarily for up to 30 days pending background check results. If the criminal background results pen beyond 30 days upon receipt of a past criminal background check, the attendants may submit shifts older than 30 calendar days for reimbursement. Number 2, eligibility delay. Medicaid eligibility is required for shift reimbursement. If there is an unforeseen issue with the member's eligibility, the attendant may submit shifts worked older than 30 calendar days for reimbursement once the member's eligibility has been reinstated. Number 3, enrollment delay. Attendants must enroll with the fiscal employer agent for reimbursement. If the attendant is unable to submit shifts due to unforeseen delays with the enrollment process, the attendant may submit shifts worked older than 30 calendar days for reimbursement once enrollment has been completed. And number 4, service authorization delay. A service authorization is required for shift submission. If the attendant is unable to submit shifts due to unforeseen delays with the member service authorization, the attendant may submit eligible shifts older than 30 calendar days for reimbursement once the service authorization is successfully loaded into the fiscal employer agent portal. Note, an FEA to FEA transition process shall be developed in support of the 30 calendar day limit for individual. And a reminder, only live-ins can use either the EVV app, IVR, or web portal to document their tasks for the day. All other attendants need to submit their shifts through an EVV app or the IVR phone system to remain in compliance. On behalf of the Department of Medical Assistance Services, I would like to thank you all for listening in today. And as promised, here's the resources page full of the contact information as well as some website information for you. So first up, the top left, we have DMAS's website. This specific URL houses all of our trainings as well as more information that you all may need. This is www.dmas.virginia.gov/for-providers/long-term-care/waivers. Right below that is the EOR manual, which I refer to quite a bit during this training, and that can be found at www.dmas.virginia.gov/media/386/employer-of-record-manual-august-2021.pdf. This is in the process of currently being updated. So once updated, we will go ahead and post that in the same spot for you all to reference. On the right-hand side, we have the Consumer Direct email address, which is cdattendantinfo@dmas.virginia.gov, as well as the CCC Plus email, which is cccpluswaiver@dmas.virginia.gov, and finally the DD waiver, which is ddwaiver@dmas.virginia.gov. All right, and to continue some of the resources for you is the free phone. So for those of you who do not have a phone to access the EVV app to stay compliant, we have resources to help you. On the left-hand side, you can use some of DMAS's resources. And if you are through an MCO, you'll need to contact them directly, and their information is below. Again, thank you all for listening into DMAS's Consumer Direction Fall Training. We will update everyone on when the next education events will be shortly, so please be on the lookout for that. We look forward to seeing you all soon.